Support for the podcast comes from Pediatric Psychology Center of Chester County. At their locations in Exton and Downingtown, Pennsylvania, they offer assessment and therapy for neurotypical and neurodivergent children, teens, young adults, and their family members. They believe that finding a perfect fit between client and clinician is of utmost importance and will work to make sure that you are expertly matched, even if that means connecting you with another office. Learn more at chesterpsychology.com. Hello, everyone, and welcome back to Parenting Stuff I Wish I Knew Sooner and Want You to Know Now. I'm your host, Erica Desper, the founder of the Center for Confident Parenting and just a mom who seems to learn everything I need to know the hardest way possible and well after I need to know it. I am on a mission to help you avoid the same. And to that end, today I am joined by Dr. Emily Height of the Pediatric Psychology Center of Chester County. Dr. Height, thank you for joining me today.
Thanks for having me.
Always. So before we dig into our topic, just tell everybody a little bit about yourself, how you came to do what you do, why you love to do it.
Yeah, so as you mentioned, I am a doctor. So I'm not a medical doctor, though. I have my doctorate in psychology. Moreover, I'm actually a fellow at the Pediatric Psychology Center of Chester County. So I'm wrapping up my fellow year, about halfway through. So maybe not wrapping it up quite yet, but about halfway through. I actually have
that, though.
Yeah, right? Powering through. But I have a bachelor's from Bucknell University, and then I did my master's and my doctorate at the Philadelphia College of Osteopathic Medicine. Let's see.
I have some family at Bucknell, so go Bucknell.
Right, Bucknell. Very big fan. You can see my bison pillow in the background for those watching the video of this. I've always loved working with kids and families, specifically kids and families of different needs, differently abled and special needs. I've always found my niche really in advocating for them and trying to help make lives a little bit easier. And I've been doing that even since high school. In high school, I was part of a softball league for kids and families with Down syndrome. At Bucknell in college, I worked with a STEAM program, providing after-school education and tutoring for kids with special needs, and then naturally just translated through till grad school, and here I am.
Awesome. Well, we're thrilled and lucky to have you. So one of the things that you're passionate about is helping parents of neurodivergent children to understand and then also cope with these like very big behaviors that often come from very little or not so little bodies. And as the parent of a neurodivergent teenager, I am well familiar with this challenge. Why is this something that you chose to focus on?
Yeah, so actually I'm neurodivergent myself in the sense that I have ADHD, or for those that maybe aren't familiar, it's attention deficit hyperactivity disorder. And I think even within neurodivergence, something that people don't understand is that every brain is so different and it works so differently. And so what works for one person may not work for another person. And I became really interested in advocating for neurodivergence and working with parents of kids who are neurodivergent because I understood, looking back, hindsight's 2020, right? I understood that a lot of my own challenges growing up could have been solved by some different strategies that my parents, who were probably struggling just as much as the many parents that I work with now, didn't really know how to work with my brain.
Yep. Yeah, that's great that you come from a place of that side of it, because we know that that's lacking. We hear a lot about neuro-affirming practitioners. Can you just touch on that a little bit? Like what exactly does that mean? What are we looking for?
Sure. So a neuro-affirming practitioner, in theory, because everybody practices a little bit different, but in theory, it's somebody that recognizes, understands, and is accepting of neurodivergence. So at its core, you're not trying to change who the person is, right? So in the olden days, there's a lot of stigma about people or autistic individuals in the autistic community, specifically around like hand flapping. A lot of people had problems with this, trying to change that, trying to stop that. Neuroaffirming is the opposite, where we're not interested in that at all. It doesn't matter. We're interested in helping that individual lead the best life that they can. And what does that look like for them? What does that look like for their family? How do we get them to be to that next step, to that next stage?
Right. So anyone can strive to be, claim to be
a neuroaffirming practitioner, I would assume
Right.
that it's a little easier for someone who actually has lived with neurodivergent. So you have sort of the double whammy of the education piece and then the personal experience.
Yeah, for sure. And I mean, I think that neuroaffirming, you do have to be a little bit careful because it's become such a hot topic and a buzzword lately that I think that some of the meaning can kind of get lost. So always do your research, do your due diligence. And I always tell families that it's okay if you don't find the right fit the first time. It's kind of like a pair of jeans, right? You have to try
Yeah.
on a few before you find the perfect fit. And that's
And fit is
okay.
so important with
Yeah.
stuff
And
like this, for
it
sure.
can be so discouraging too when it doesn't work out. And I hear that, but be brave. We can do hard things. Try again. You'll find the right person for you and your family. It'll be okay.
Yes, there's many times I've given up on finding jeans that fit my tiny, curvy body. But if we're sticking with that analogy, I have recently discovered a brand that was like, it's like they know me.
There you go.
So the right person is out there, just like the right pants are.
Absolutely.
So one challenge I had with, or we had with our son, what very early on in our journey was determining like, is this, are the challenges we're experiencing? He's our only one, so I am pretty hip to parenting challenges because that is what my main hat is. I consult with parents, but you know, it's yours, and so it's different. And he was my first and only, so like how much of this is just age related, like a phase that the child is going through, or like button pushing behavior or lack of regulation but appropriate for the age, versus like this might suggest something more and we should maybe have that looked into, maybe we need some support. So what would you say to a parent that's like tossing that around in their head?
For sure. I think first and foremost, if you're ever having a question in your mind of, is this normal? Always speak to your pediatrician. It's never too small of a question, in my opinion. And I'd so much rather them be so annoyed that Dr. Emily said that it's okay to ask these extra questions than to you keep it to yourself, right? Because fear breeds in the dark. And if we leave it alone and we don't touch it, we're never going to do anything about it. And we're just going to exist quietly in pain. But
Yeah.
I find that it's time to step in and it's time to get the extra help. If you find yourself spending most of your day focusing on the things that have gone wrong as opposed to the things that have gone right, if it's
Mm.
taking up more of your mental energy than anything else, it's probably time we talk to somebody.
Yeah. And in terms of getting support, correct me if you wouldn't agree, but that doesn't require a diagnosis. Like, obviously, we want to get evaluations and diagnoses, and we'll talk about that if we can. I mean, most of us want to, but I tell parents, like, anytime it's taking up your mental bandwidth, the worry, or like you said, the logistics of navigating it throughout the day, then that means you need support. Like, there doesn't have
Mm-hmm.
to be a reason for that. It could be like, I just don't know what to do with this, and maybe
Yeah.
someone else is rocking it, right?
For sure. And to your point, I think that everybody benefits from help in some form or another at one point in their life or another, if not many times throughout their life. And none of that requires a diagnosis, right? You don't need a diagnosis to go to the doctor. You shouldn't need a diagnosis to seek any type of therapy. Some types of therapy are more specialized and specifically work with certain subsets, but that's kind of as we fall down or not fall down, but climb up the ladder, the hierarchy of need, right? But there's always that base level of just reaching out and asking for support. Anybody can do that.
Right. And I would put it to parents and caregivers, like, parenting obviously is the hardest job in the world. No one really knows how to do it well all the
Yeah.
time, and we can't be prepared for everything. But to your point earlier, the way these kiddos' brains work is so unique and individualized that of course we're going to need support navigating that, because neurotypical kids don't come with manuals and you have to
Yeah.
individualize. This is even like it's like a higher level of that, right?
And even if you're struggling with a neurotypical child, because that's perfectly acceptable too, just because my shtick is
Sure.
working with families who are neurodivergent and kids who are neurodivergent, doesn't mean that you don't struggle with a kid who's neurotypical. That's entirely possible, right? And I always tell people, like, if your life is fine, we can still step in, right? We're not shooting for fine. We're not trying to raise kids who are fine. We're trying to raise kids who excel and who are flexible and resilient. And so if you're ever having that question in yourself of, what can I do? Am I struggling? I'm having a hard time. That's an appropriate time to reach out to somebody for help, regardless of what your family looks like.
Yeah, that's a really great point. I think I had this conversation with a neuropsychologist at one point, and I said, like, who's your ideal, client or patient? And they said, like, anyone with a brain, right? So
Mm-hmm.
it sounds like, all of us parents were parenting these little underdeveloped brains. So neurotypical, neurodivergent or not, we're all going to have questions and concerns and need support. So that brings me to my next question. In your opinion and experience, when might a parent say, like, okay, this is, maybe I don't just need help, maybe we need a true evaluation because of the behaviors that we're seeing? And then the flip side of that, like, would you ever tell a parent, like, no, don't do that yet, let's wait and see? But generally, I'm not of a wait and see mindset based on my own personal and professional experience, but I'd love to hear you weigh in.
Yeah, I think it depends on a lot of factors, right? So it depends on the age of the kid. So if we're thinking my kid is so hyperactive, they're bouncing off the walls, but they're 3 years old, I'm probably going to say, okay, let's let them wait a little bit longer. Let's see if this is just a toddler phase, or if we grow out of it as we get into school, we get the structure, we get the routine. But as those problems, theoretically, as those difficulties continue on, that's when it's probably relevant to seek an evaluation. It's always appropriate to ask your provider if an evaluation is relevant. And if you have a good provider, they'll be able to tell you yes or no. I always joke that it's like plastic surgery. You'll have a good plastic surgeon who will tell you, no, you don't need it, or yes, this is a good idea. Because I'm the type of clinician who, I don't think testing just to test is helpful, right? I don't like to do exploratory testing, exploratory surgery, if you will. I don't think that's helpful. But I always welcome the question, and I always welcome the conversation, because at the end of the day, testing is just going to tell us more about how their brain works. But that's only relevant if we can do something with that information. So if everything's going great at home and things are great, and your only reason for seeking an evaluation is just because you're curious, that might be a time where we think we can hold off and wait. But if you're ever wondering if it's a good time to talk about it, schools are a great place to start. Schools are invaluable resources. And asking your teachers, asking your SPECM, asking your special education department, hey, I'm seeing these difficulties, what should I do? More often than not, they're going to have suggestions for you, and they're going to have a place to start.
Yeah, that's great. And just to clarify, and again, correct me if I'm wrong, if you told someone, like, I think autism maybe can be diagnosed by some as early as like the toddler stage, but ADHD is a good bit older. And that's always changing. But just because maybe someone is told, like, oh, we don't diagnose ADHD until X, the challenges are there. So the worst that would happen is someone says, no, let's not evaluate formally for that yet. However, I see characteristics and you see struggles, so let's give you some support around that, right? So it's like still not
Absolutely.
too early. Yeah.
Absolutely. Executive functioning challenges, which are the kind of the foundation of ADHD, are universal. Most people, regardless of their cognitive profile, are going to have some level of executive functioning challenges, but true executive functioning deficits, diagnosis or not, are worthwhile seeking help for and worthwhile getting support. And I tell parents all the time, I have 101 recommendations, but you don't need 101 recommendations. You need the few that work for you and your family.
Yeah. Yeah. Very, very true. Okay. So beyond evaluation, like we keep talking about get support. Like, what are we actually talking about? I know, like, talk therapy isn't always the right kind of thing. So what are these supports that parent could seek, and like, why, how might they help? Why might they want to seek them out?
Sure. So there's all different types of support. We keep saying that word, I know. But so to your credit there, to your point rather, there's talk therapy, but even within talk therapy, there's the different modalities. And people familiar with therapy as a whole might be more familiar with things like CBT or DBT, cognitive behavioral therapy, and dialectical behavioral therapy. Those are kind of the two big ones that get floated around within the neurodivergent community. But there's more than that. It's a broad spectrum. So going back to our jeans metaphor, you might have to try a few before you find what works for you, and that's okay. And different providers offer different treatments beyond just the traditional quote unquote talk therapy. There's also things like occupational therapy, physical therapy, and all of those things are wonderful and relevant if that's something that your child or your family in general would benefit from. And having those conversations early is so much better than waiting. So you wouldn't wait until a cut on your arm is super, super infected to go to the doctor, right? You put a Band-Aid on it and you'd address it. and you'd seek out help, whether it's just as simple as an ice pack or as major as going to the hospital, right?
Yeah. And if parents don't know, there are therapies like play therapy, art therapy,
Absolutely.
music therapy. Do you find that maybe neurodivergent kids who don't respond well to traditional talk therapy operate better in those arenas?
Absolutely. But I think it also is relevant to mention passion. So if your kid is really averse to noise in particular, we might not want to start with music therapy, right? That might be throwing them into the deep end a little too soon. So we might want to start slowly and build up. And so for some families, that might look like weekly therapy. It might look like biweekly therapy. It might look like different therapies multiple times a week. One that I'm really passionate about is always equine therapy. I think it's so wonderful. The kids love it. Families tend to love it. And really good equine therapy providers are just so invaluable. It's really such a great experience for the kids and
just
families.
In case anyone doesn't know that word, we're talking about horses, right?
We're talking about horses. Yes.
I think we're all hip to that at this point, but we toss around so much lingo. I always like to step back and clarify so no one feels like, am I the only one who doesn't know that? Okay, awesome. And how, I did not ask you this in advance, but I'm sure you can speak to it. Obviously, you're currently at Pediatric Psychology Center of Chester County. Of all these supports that we keep talking about, like how are you and then the clinic as a whole helping kids and families?
Yeah, absolutely. So I guess I'll start by telling you a little bit about my practice and what I do, my practice within the practice, if you will. So I see kids and families. I see 0 into the early teens, and then also parents as well. I do see some older adults as well if they have cognitive impairment and cognitive challenges. I have a really niche specialty with IDD, which is intellectual and developmental disability. So I will see a little bit older as well, depending. But not to get too much into the weeds. I'm formally trained in CBT, cognitive behavioral therapy, as well as ACT, which is acceptance and commitment therapy. Really passionate about ACT. It's based on values. Really love it. I could go on and on about ACT therapy forever, but I won't bore you. I love it so much, but I like to incorporate a bunch of different modalities. So a multimodal approach. And you can't really quite see in the camera for those of us watching the video, but I have a ton of toys and I have coloring pages and Play-Doh, and I've learned my lesson, no more slime, but
haven't we all?
markers, like books and videos, whatever works, right? Because what's most important to me is that collaboration and that buy-in. So I offer parents the opportunity to tell me if something's not going well, but also be open and willing to try something new. Because like I said, 101 ideas, but they don't need those. So we got to try and work through it. And I'll offer parents the same feedback as well. Hey, I heard about this. It's going great. Let's try doing more of this. Or maybe that's not the best approach. Let's try something else. And for a lot of families, that looks like having regular parent sessions to talk about what's working and what's not, and also new strategies, but also just to provide that extra level of support. Parenting, like you said, is the hardest job in the world. And parenting a child who has difficulties of any kind, whether it's cognitive difficulties, physical impairments, whatever the spectrum looks like, is so hard. And I think parents don't get enough credit for just how hard that is. So being there for them is really important to me, just to say, hey, I know this is hard. What do you need from me to make sure you're okay to do this?
Yeah, and that I'm glad you mentioned that, because we so far have kind of talked about therapy or services for the child, but I know that I don't know if you specifically, but there's so many providers at the practice. I know that some of them offer coaching to the parents. It sounds like you kind of build that in a little bit.
Yeah, I like to build it in.
To know that like it can be two separate things. It's sometimes joined.
Right.
Because it's not super helpful as a parent to have my kid working with someone, but I'm not present for that. And I don't really get pulled into like, what were the strategies? How can I keep them going? There have been times my son's been seeing providers and I have zero idea of what's transpiring. And then there's no like connect between home and there. So parent coaching is, I know, another thing that is offered there, which is awesome.
Yeah. And looping back into your earlier question about what the larger practice looks like. So we have 3 locations and we have 16 different clinicians who are across different trainings, different modalities. So there's a little bit of something for everybody. So they have clinicians that see parents exclusively, or almost exclusively. And then we have clinicians who see just teenagers, clinicians who see kids and parents, kids who see siblings, clinicians who do music therapy, art therapy, dance therapy. We kind of do it all. And then we also have really interesting groups that are run. Right now, they're running an improv group, right, and a Dungeons and Dragons group. We do it all. A little bit of this, a little bit of that.
And I know from interviewing other providers there that you're not the only one who is also neurodivergent yourself. So that's a really nice,
true.
We're talking about neuroaffirming. I just think that's a really nice feature.
Yeah, absolutely. And if that's something important to families, definitely seek out a provider who's willing to offer that level of support. But I also encourage you to have an open mind. If you've never worked with a provider in general, don't be scared away just because they're also neurodivergent. Be open to their perspective, because they might be able to understand your child in a different way than you do, simply by having that feature of their brain is different too.
Mm-hmm. Well, and I would imagine that the child may feel more open or understood, or just by knowing that fact, if that's something they'd generally be told.
Yeah, absolutely. And I mean, studies show that the most important part of getting something out of therapy, of the effectiveness of therapy, is that therapeutic relationship. Mm-hmm. So having the kid, I said the word buy-in earlier, but really clinically we call it rapport. Having that rapport and having that established trust is so important. And making sure you and your child are comfortable with who you're working with should be top priority when finding a provider.
Yeah, great advice. All right, I think I just have one more question for you. So
yeah.
If the family is noticing, coping, navigating any or all of this, what else would you like to say to them today? What do you want them to hear that we haven't said yet, or something you want to emphasize?
I think something that would be worthwhile emphasizing is something I tell all the families the first time I meet them and start working with them, is that I might be an expert in this room, but you're an expert in your child. You know, trust your gut. You know what you're talking about. If something is wrong in your mom brain or your dad brain, trust it. You know what you're talking about, and don't let anyone dissuade you otherwise. And I guess the other thing I'd like for them to know is fill your own cup, right? We can't pour from a cup that's empty. Seek your own supports if you need it. Reach out to your support network, reach out to your village, find communities that can support you, because it's so hard and it can be so lonely if we let ourselves struggle in silence. So to those people that are going through that, listening to this podcast or seeking out help, or maybe they're seeking out this podcast because they're starting their journey of seeking out help, I think finding places where they're not alone is so, so important, because you're going to be the best version of yourself when you're rested, when you're mentally capable, and when you're ready to step forward and do those strategies with your child.
Yes, I love that so much. And if anyone listening has listened to the previous podcast, they've heard me say the same things over and over and over. I wish, part of why I'm on this mission and have this passion project is because I wish I had trusted my gut more and earlier on, and I let other people around me, even close family members, that said, like, no, he's not having a hard time. He's giving you a hard time. And it's age related, and it's his temperament and his personality. And some of the, I mean, they're both things were true. And he had 7 diagnoses that nobody knew about that took us 7 years to get. Yeah. So I was not an expert on any of this, and still am not, but I was an expert on knowing his potential and how it didn't match his performance and how he was just falling apart after even giving the performance that he was giving. So definitely on board with trust your gut. Thank you so much, Dr. Haidt, for joining me. That was
Thank you for having me.
Yes, I'm sure I'll have you back to dive into other topics, but today was kind of the overview. Parents and caregivers, I'll be back soon with more stuff that I wish I knew sooner and want you to know now. In the meantime, I'll leave you with a list of my stuff that I've learned. Some of my stuff I've learned the hardest way. And actually, I think you said it all already, but I'm just going to say it one more time. Number 1, we are not meant to do life. It's certainly not parenting alone. So accept help when it's offered to you. I know it's so hard, and even harder, ask for it when it isn't. I am still learning this today as we speak. It's not easy. 2, you cannot pour from an empty cup. Sometimes I like to say you can't clean with a dry sponge. Try it. Like, go try it. It's not going to go well. So be sure to schedule ways to replenish yours every day. And the scheduling part's important. It won't just happen. That to-do list is always going to be there. It's only going to get longer. And last and not least, there is no way to be a perfect parent. There are so many countless ways to be a really good one. So let's make that our goal. And there are people that can help. Hopefully that was helpful to you. And I will be back soon with more. Thanks, everybody. Thank you, Dr. Height.
Thank you. Bye-bye.